Welcome back. We're glad you're watching the Weekend Express. Now, the Kenyan government reports that in just 1 year, close to 10,000 Kenyans spent 10 billion shillings seeking treatment in India. So what is it about India that draws so many Kenyans? Some go to India because of lack of specialists in Kenya, but for those suffering from a chronic back pain, there may be another solution. Our guests in studio this morning have come with the latest technology on health issues that people seek in India. And they say from now henceforth, there will be no need of patients going to India for back pain treatment, which they can offer. Let me introduce my guests in studio now. On my left, we have Dr. Mishra, who is the chairman of Medihill, based in Eldoret, I believe. Right, thank you very much for joining us. We also have Dr. Shiraz Munshi coming to Kenya all the way from India. Welcome to Kenya.
Thank you.
All right, and then we have Simran Dadhiala. I hope I pronounced that right. And you are a patient who has benefited from this new technology, yes, as well as Donald Membo, as well a patient who has benefited from this technology. Yes. Thank you all for joining us in studio this morning.
Thank you.
All right, so let's begin with you, Dr. Mishra. We're talking about treating chronic back pain, but let's just begin with, you know, what is back pain? What types of back pain do we have?
Well, the back pains, I'm not the specialist, is Dr. Munshi, but back pain is, there are two types. One is physiological and another is pathological, and it is also lifestyle, the posture, how we behave in the lifestyle, in the day-to-day activities. And also there is pathological, which is both traumatic and classification to degenerative. Now the spine is the organ in the body which takes care of the postural things, most of the posture in the body. But now trauma, as we know, trauma can cause back pain.
Right.
And then also the degenerative. As the age advances, there is degenerative process between the disc, between the spines and vertebrae and other thing. So apart from that, there are certain special conditions like pregnancy and also causes back pain. Yeah.
All right. Now, Dr. Shiraz, I understand that back pain can sometimes be so bad that it warrants an immediate emergency visit to the hospital. So tell us about some of those symptoms that can lead to chronic back pain.
Yeah, you see, the most important thing in the back is that we humans, the back is flexible, and at the same time it has to be more strong. So these are the two controversial things. These are the two opposite things. The strong cannot be flexible and the flexible cannot be strong. So it's all our lifestyle, like the bending and lifting and the bed posture. So this all leads to the pressure on the back. So there are many things in the back. So we say that the back pain is a generalized term. So there are the muscles and the vertebrae, and then the disc and the ligaments and the bones. So out of this, all can go into the degeneration with the age, and that is going to happen with everyone. So something like somebody is lifting heavy thing. So the back is actually in the center of our body. So whatever you lift, the center is in the back. So that puts the pressure on the disc, and the disc is a soft structure. So disc can compress between two bones, and the disc can break. So once the disc break, it has some chemical irritant, which goes out and it irritates the nerve, and it produces a lot of pain, and that pain is so severe that the patient says that this is the most worst pain I have ever experienced in my life.
So it can be very chronic pain.
Very, yeah.
All right. Now, that being said, Dr. Mishra, a lot of Kenyans then, when they have such problems, they prefer to seek health attention or medical care from India instead of doing it from Kenya. Why is that?
Well, now I will tell. Kenya is younger than India by 16 years as far as colonial independence is concerned. Right. Kenya is in exact position 5 to 8 years to come that Kenya will be the leader of East and Central Africa, 500 million people of 27 countries, as the leader of health, tourism and travels, right, that as far as concerned. Now, what is happening now? Now the Kenya, the infrastructure, the logistics, the human resources, what we are getting, and of course, the leadership of the country is helping Kenya to become the leader. Now, what we are doing, Medihill Group of Hospitals in East and Central Africa, we are transferring the technology from India to Kenya.
Right.
Because it will be cost effective, it will be more, the treatment will be viable, because traveling itself has another stress.
Right.
And so now last 3 to 4 years, this specialty called non-invasive pain management is only practicing in 15 to 18 countries in the world, and Kenya is one of them. So now thing is that we are seeing that no need to go to India, now we can treat here. So what I am telling you, another 4 to 5 subjects of specialities in medical fraternity, if we cover, will be the destination. One is navigated neurosurgery and spine surgery. Another is complete cancer solution, both radiotherapy, chemotherapy, and oncosurgery. Then we can do open heart surgery, bypass surgery, and pediatric birth defect cardiac diseases. And then, of course, transplant surgery.
Now, are these technologies that are already being practiced in Kenya, or something that you're planning to bring to Kenya?
No, already we have started practicing, but very initial stage. And with the time, I think I told you 5 to 8 years, Kenya will be completely self-sufficient to practice. Like we, Medihill, Eldoret, we are starting October, November, kidney transplantation.
Right. Right. I mean, but then, when it comes to Kenyans, many times there may be no specialists in Kenya, that's why they choose to go to India, but many times the same technology or the same equipment could be here, but they just want to go to India because they feel when they go to India, they really will get better. So are you having that challenge of convincing patients that we can do just the same service that you get in India?
Sometimes yes, because it is we are in a transition.
Right.
So in transition always takes the people have to have trust, confidence, and also they will be used to it, Kenyan way of practice.
Right.
But I think with the time we'll overcome that. Yes.
Okay. All right. Now, Dr. Shiraz, do tell us more about this technology. What does it entail exactly?
Okay. You see, the interventional pain management is a recognized subspecialty of the medicine. It is a super specialty branch, and so in interventional pain management, we are doing something to find out the reason for the pain. Like if you say the back pain, so back pain is a generalized term. So we have to find out which part of the back, which structure in the back is the reason for the pain. So our first goal is to identify the source of pain, and believe me, till now in the medicine, before the pain management era, there was a gross diagnosis. So like you do the test and you say, okay, back pain, you just have a corset, or for the neck pain, you just have a collar, and then we cannot do anything. But now, because of the advancement in the technology, because of the availability of the MRI and the CT scan, so we have the anatomical information from the patient's back, and then depend upon the MRI finding, our clinical judgment, patient's presentation, we come to some conclusion. Okay, this looks like a source of pain. Like suppose somebody is having only back pain, and the pain is just near to the midline. Then there are some structure called the joint of the spine. So suppose if I make my clinical diagnosis of that this pain is coming from the back, from the joint of the spine. So what we do a simple test. So we take the patient to the theater. There is one live action machine. So with the just needle, we go to the joint and we put some local anesthesia medication. So we just numb the joint. So out of the many structure, we have just numb one structure. So suppose, and then we ask the patient to stand up and do all the activities. So if the patient says that after getting this injection, after getting the joint numb, I'm better, it means it's very clear that the pain is coming from the joint.
Right.
So same way we can do with the disc. So first of all, this is very important to identify the source of pain. Suppose if somebody is having joint pain and somebody do the surgery for the disc, definitely the patient is not going to benefit. So the pain itself is the best presentation, because pain is also a protective mechanism.
Right.
If you don't have pain, you don't able to identify what is happening inside. So first we identify the source of pain, and then now we have all the technology without surgery, without cutting. Like somebody is having the disc herniation, so now we have a technology that we can with the endoscope we can go from here, patient is completely awake, we can see everything on the screen, and then we can just remove the disc, and after half an hour the patient can stand up and walk.
After half an hour?
After half an hour.
Wow, so this is a new technology, but traditionally what methods of treatment would be suggested to a patient like that?
Yeah, you see, it depends upon the severity of the pain and the patient presentation. Suppose if somebody is having the long-standing back pain and that once it start affecting the lifestyle, so usually the first few weeks we try for the medicine and the physiotherapy and of course with the lifestyle modification. So suppose if we wait for 4 to 6 weeks and patient is better, then it's okay. We don't need to do anything. The patient just have to take care about the lifestyle. Suppose after that the patient is not getting benefited, then we try to do some test, MRI or something, to see that what is the severity.
Right.
Some patients they come with a lot of pain, maybe that they have a weakness, the leg is getting numb or something. Then we immediately do the MRI and then we do the immediately treatment. So everything depend upon what is the presentation, how is the severity, and depend upon that we go for the treatment.
Right. That's a very interesting technology. We'll be speaking about the cost implications in just a moment, but Simran, you're among those who has benefited from this technology.
Yes,
but when we speak back pain, people don't really think it's something serious. You know, when you carry a handbag, sometimes you get home and, you know, your back really hurts. How bad was it for you?
It was chronic because I actually woke up with excruciating pain on my left side.
Right.
Because it got to a point where I wasn't able to do normal activities of, say, standing for too long or walking, sitting for too long, either driving. So it was chronic and it needed attention because it had slowly started going down my left leg as well, giving me a sort of a tingling sensation.
Right.
And that's when I knew something was definitely wrong. Yes.
And now, did you try to seek any other help before you met this new technology?
Yes, I did. But of course, that was just more of like a temporary relief, which gave me relief for, say, about a couple of weeks or so, but it was back to square one. And of course, by that time, it got worse. It was getting worse.
All right.
Yes.
So how did you learn about this new technology? Did you think of going to India first yourself before?
Actually, no. It was more of a coincidence because my mom has previously been a patient with Dr. Munshi.
Right.
She also had the invasive surgery in her neck. So it just came naturally to see him. But of course, before I met him, I did have the first treatment. And by the time I was having the pains the second time, it was just a rare coincidence that Dr. Munshi was around at the time as well. So that's when I went to him and sought the treatment.
So how long had you been suffering from the back problem?
I'd say about a month to a month and a half.
Right. And as soon as you had the treatment,
I
that
was
is it?
good to go, yes.
You've never had it since?
No.
Wow.
Yes.
Okay, so that's a good testament there. And Donald as well, you're also a beneficiary of this new technology. Tell us about your experience.
Actually, my problem started way back in 2008, 2009.
Right, that's a long time
Actually,
ago.
from started having pain in the feet down there. So I sought help from many doctors. So I went for therapy, was given medication, and for a long time they've been treating it. You get a bit of relief from the pain. We go back, more medication, different medication, stronger medication, therapy here and there, and after some time you feel like no, something is still not right, because they're actually not getting to the point, or yeah, they're solving the problem. So as just resonating with my colleague here, you know, I actually got to know about our doctor here also by coincidence. Two ways. One, from my dad, who was also trying to see where he can get some solution for his ailing child. And secondly, from one of my colleagues who actually said that he knows someone who is coming to Medihill from India, and he knows more about this treatment. Just go and see him and see what he's going to say. And I sat down with the doctor. He never knew me. He was sitting down. He looked at me, and in 2 minutes he was telling me, you know, it's your back. And I looked at him and thought, this guy must be crazy, because I've been looking for a problem, for the solution to the problem for such a long time. And in 2 minutes he tells me it is your back, without even having looked at my MRI and everything. But he said, fine, we'll check, we'll look at your MRI, we'll look at what has happened to you. And after that, we just went for treatment.
Right.
Yeah.
And you've never had the pain since then?
Actually, my history is a bit twofold, because then that is in 2013 when I first met the doctor at Medihill. the treatment was done in Eldoret. And after everything was done, I rested for some time, and things went back to normal completely. Then I think I developed some kind of a complication.
Right.
But again, I went back to him. You know, then he again sorted it out. This time in a very different kind of format in a way. And that was actually just a month or so back. That is in June.
Right.
Yeah. And funny enough, you know, he treats you and he finishes with you. He looks very casual as a doctor, and he'll talk to you as if you just his next door neighbor.
Right.
And he'll call you as if you're going to have a cup of tea, and you're actually going to the operation room. Then he starts working on you, and after an hour he tells you, "Boss, wake up, let's start working."
Right.
And after that, I was actually working. My colleagues from work were asking, "Are you working now?" I'm telling them, "Yes, I am working."
So how long were you unable to walk?
I wasn't unable to work at all.
Oh, it was after the procedure.
After the procedure, I was able to walk properly and sit properly. The problem basically was not being able to walk for a long time.
Right, right.
After about 10 minutes, I had to take a rest. Not being able to sit for up to 5 minutes. How long have you been here for? So long?
I've been here for 2 hours now, sitting.
Now for
So
us.
you could not have been here for this long.
For here, we've been here for now like maybe say 20 minutes.
Right.
Yeah, and I've been seated. It was 5 minutes, and I had to stand up and maybe take a walk so that at least I can release the pressure
Right.
from my back.
All right.
Yeah.
Now, Dr. Mishra, you know, from the, you know, what Donald and Simran are saying, especially Donald, talking about how Dr. Munshi was very casual with them, you know, they relate very well. Talk about the Kenyan Medicare system. You know, I've had a lot of people who have had to go to India. They say, you know, the doctors there are so nice. They don't first ask you for money. They want to know what's your problem. Because here you go and they ask you, do you have money for consultation? If you don't, then you go back. So how would you say compare Kenya's Medicare, you know, to India's Medicare when it comes to doctors themselves?
Before I start, I will tell you our health education system. I was senior lecturer in the Mo University in the medical school.
Right.
And reproductive health gynecologist. I'm a gynecologist. So I taught 17 batches of medical school. First of all, we have to create more education system.
Right.
Now, as we all know, our leadership in the country, they are very keen to develop and prioritize the health, and which is doing very well. But the thing is that 70% of our specialists are concentrated in Nairobi. The rest are, we are distributed in less part of the country. We have to evenly distribute our specialists, because the specialized treatment is very mandatory now to the, as far as the treatment is concerned. Now, as far as Kenyan doctors are concerned, well, this is, the doctors don't ask money. Most of the, it's also competitive now. But having said that, we have to, Kenya is not a manufacturing country as far as medicine is, and appliances and disposables and pharmaceuticals are concerned. So that increases our cost of the treatment up to the 1H. But slowly, as you say, when I came to Kenya in 97 and now today, the cost is going down slowly. So more competition, more development, the less cost. But we don't say cheap, cost effective. But if you see India, India is not cheap.
Right.
India is costly. Like kidney transplantation, we do Harambes, and we take 3.5 to 4 million with air ticket and the relative and everything.
Right.
But if we do here, 1.5 million selling, and the NHIF is going to pay 500,000. So we are getting there, but the psychology also play a big role.
Right.
Yes.
Right, especially like as Donald mentioned, you know, you go to one doctor and they give you temporary relief. You go to another doctor, they give you a totally different, you know, idea again, temporary relief. And so that has made, you know, Kenyans now have this view that, you know, Kenyan doctors just want money because they want me to keep going back. So they'll just give me a painkiller and I go back. So that's the problem when it comes to, you know, Medicare in Kenya. Now you say when this equipment comes to Kenya, it will be cheaper. Yes.
I'm sorry to interrupt you. You see, even today, in many parts of the world, the chronic pain is such a big mystery
Right.
that even the best of the doctor, even best of the specialists, let me tell you that what the treatment what we are doing, even the 90% of the doctors, they are not aware.
Right.
Because you see, once I'm an ophthalmologist, so my concentration is all towards the eye. So I'm not looking about the other specialty what is developing or something. And this is happening in every part of the world. So even if you go to US, the same the specialist, because you see there are many different specialists. The general physician, orthopedic, chiropractor, neurophysician, neurosurgeon, and the pain management doctor. And even there are so many other, the acupuncturist and so many other specialty. So this is because of the complexity of the back pain. So it's not like that somebody is giving you pain, because they are not even aware that how much. And see, if you don't feel the suffering of the other person, then you don't realize. You say back pain, okay, take this medicine. How it can be so
Right.
severe? So this is all about the perception, but the most important thing is the new development and the new technology what has come. Even the medical fraternity is not much aware. So they just want to give some relief to the patient in the way what they know.
All right. Now, Dr. Mishra, you mentioned that Kenya is not a manufacturing country. So, of course, most of these drugs and this equipment comes, and then the cost of healthcare is a lot higher. But when it comes to this technology, you say it will be a lot more cost effective. How is that?
Well, first of all, I'll tell the infrastructure to establish this to complete treatment to offer to a patient, we need 100 million cedi. With MRI, it is 250 million.
Right.
The MRI itself is 150 million. Then CT scan, then imaging spare. We have a very special theater, and of course, human resources and other disposables, endoscopy unit. Now, I tell you one thing, that you remember when the cell phone came, the SIM card was costing us 2,000 cedi.
Right.
Now SIM card is free. So everything is going down when it will be popularized, the technology, and the trust and belief will come, and users are more. The turnover is high. So we are heading for that.
Right.
It's a transition, I told you. But Kenya is a very blessed country, and it's going to be leader. Now look, hip replacement surgery, hip replacement, knee replacement. Nobody is going to India. Test tube baby, IVF. We are the one of the leaders. IVF, nobody is going to Cape Town or Sheffield or Mumbai.
Right.
So the thing is that we are heading slowly there. The cost will be, it will again depend. We have to regularize, where the Ministry of Health is doing very well. They're regularizing the cost. So we are going there actually. Yeah.
Right. But then what more would you say needs to be done for Kenyans to trust their own healthcare system more? Because even now we have our own legislators, we would even have the Minister for Health going abroad seeking healthcare there instead of doing something here.
Well, we have to produce more health personnel, more doctors, more medical schools, more paramedics, dentists, and also we have to go for super specialization.
Right.
Like we are at the level of specialization. We have 2-3 medical schools now, and we are producing fantastic doctors, but they're limited. Let me tell you one thing. I'll give an example. Mumbai is a city in India, not even a state.
Right.
Has population of 18 million. And how many gynecologists? 10,000.
Wow.
Kenya, what is the population? 45 million.
45 million, yes.
Now, how many gynecologists? 1,000 registered. Rwanda, how many population? 12 million population. 32 gynecologists.
32.
32.
Wow.
We are in Rwanda also. So the thing is that we are looking for health education. Education is very important. And if we go for education and personnel with a fantastic aircraft without crew, we cannot take the aircraft up. So same thing here.
All right.
Yes.
All right. All right. We are speaking to Dr. Mishra, Dr. Munshi, Simran, as well as Donald Member about a new technology that eases back pain, and patients may no longer have to travel to India to access this technology. Medihill Group of Hospitals does give that technology right here in Kenya. Now let's take a short break, but